my name is Earnest Simpkins, and I do healthcare administration / program management, and I specifically work in the HIV field. So when it comes to healthcare outcomes, I think I can kind of put it maybe in two umbrellas. The first one is internal communication. I think what's extremely important, especially in healthcare systems, that number one, we make the undiscussable discussable, and that there is healthy communication across the board. So meaning, for example, that there is a level of accountability for everybody, that people don't feel like they, just because they might not have the highest credentials in the clinic, that they can't contribute, that they can't hold people accountable. I think that improving communication internally would help us better coordinate care to patients, and ultimately on a long-term scale, it will help us be more efficient and effective with healthcare. In addition to that, I think the other umbrella is around health literacy. I think many times when you look at the hospitals, how they're structured, they're really geared and built for healthcare professionals and physicians, not necessarily patients. And I think one of the things that I find a gap when it comes to patient engagement is really making sure that every single patient that we see, number one, they know what they're there for, why they're there, and why they have to take certain medication that they have to take. Because one of the other gaps, which I think really kind of results in us being not as effective when it comes to costs, is just the abuse and overutilization of emergency rooms. And I think the root of it all is health literacy. And I think sometimes it's really taking that moment, that extra time in every scenario, sitting down with the patient, making sure that they can actually teach back to you while they're there, and that they have a full understanding of how they need to take their medication, making sure that they are taking the proper doses, and that they can communicate it back to you. I think that's, if they can't, then we didn't do a good job as healthcare professionals in communicating that.